Hi, Assalamualaikum. So we are going to continue the subtopic 10.4, the mechanism of blood clotting. This is the necessity or the importance for the blood clotting mechanism. It will stop or minimize the loss of blood on the injured blood vessel, prevent the microorganisms such as bacteria from entering the bloodstream, and also to maintain the blood pressure. This is the mechanism of the blood clotting. The coagulate platelet damage cells and clotting factors in the blood plasma will form an activator. It is known as the thrombokinase. With the aid of the calcium ion and the vitamin K, it will convert the prothrombin to become thrombin. Prothrombin is inactive plasma protein. Meanwhile, the thrombin is active plasma protein that acts as the enzyme. The thrombin then will catalyze the conversion of fibrinogen to the fibrin. Later, the fibrin is a thread-like protein fiber that forms a network of the wound surface to trap erythrocyte and then to close the wound to prevent the blood loss. This is the health issue related to the blood clotting. So what is haemophilia? Haemophilia is an example of an illness that prevents blood from clotting. The haemophilia is a hereditary illness caused by the lack of certain clotting factors in the blood. The excess bleeding due to small wounds or bruises can result in the death. Next one is thrombosis. What is thrombosis? The formation of the blood clot, or we call it as a thrombus. The thrombosis happens as a result of damage in the blood vessel, or the sluggish blood flow that causes the clotting factor to accumulate. Next one is embolism. What is embolism? When a blood clot is transported by the blood flow, the blood clot is called embolus. If the embolus gets stuck in a tiny blood vessel, the blood flow will stop. The blood group of humans consists of A, B, AB, and O groups. The antigen determines the blood type. This is because the recipient has antibodies in the blood serum that can act against the antigen in the donor blood. Before the blood transfusion is done, we have to consider the blood group type of donor and the recipient. If the blood group of both donor and receiver is not compatible, so it can become the agglutination or coagulation. This diagram shows the ABO blood group consists of the antibodies present and antigen present. The blood group A contains the antigen A on the red blood cell and contains anti-B in the blood serum. Meanwhile, the blood group B have a B antigen and then the antibody in the blood serum is anti-A. Blood group AB have the antigen A and antigen B on the red blood cell, but do not have the antibody in the blood serum. The blood group O have no antigen on the red blood cell, but there is anti-A and anti-B in the blood serum. This is the pregnancy and the rhesus factor. This is the pregnancy and the rhesus factor. The problem will arise when rhesus negative mother married with a rhesus positive father. Then the woman gets pregnant and the fetus have the rhesus positive. The pregnancy and the rhesus factor. During the last month of the pregnancy, the fragment of the fetal blood cell containing the antigen D. Antigen D means have the rhesus factor. It will cross the placenta and enter the blood circulations of the mother. Then, the white blood cell in the mother blood will react and produce anti-D antibodies. Anti-D antibodies will flow back through the placenta into the fetal blood circulatory system. the antibodies will destroy the red blood cell of the Rhesus positive baby before or immediately after birth. However, the concentrations of the antibodies produced is not enough to affect the first child, but then the anti-D antibodies will last in the blood circulation system of the mother. And the problem will come again when the second child is also Rhesus positive. The anti-D antibodies in the mother will cross the placenta and destroy the red blood cell of the fetus. This symptom is called erythroblastosis fetalis. The second fetus dies if the blood is not replaced with the Rhesus negative blood through the blood transfusion. In less serious situation, the baby may suffer from anemia and mental retardation. However, this problem can be solved by treating the affected mother with the anti-Rhesus globulin after the first pregnancy to stop the formations of the anti-D antibodies. This is the necessity for a healthy circulatory system. So we have to take a balanced diet that low in fat and also carry out the regular exercises, practice with often not smoking, and also not drinking alcoholic drinks. This is the cardiovascular diseases. Consists of the atherosclerosis, angina, hypertension, myocardial infarction, and also stroke. In details, we are going to discuss each of these diseases. Atherosclerosis is the formation and depositions of plaque on the artery wall. The plaque is formed from the cholesterol, lipid, dead muscle tissue, and coagulated platelet. The plaque will clog and narrow the lumen in the blood vessel. Next one is the atherosclerosis. Atherosclerosis is the early stage of the arteriosclerosis. Atherosclerosis occurs when the calcium is deposited on the plaque and causes the artery to become hard and then lose its elasticity. Next is the hypertension and stroke. The restricted blood flow can cause the hypertension. Hypertension will cause fine arteries to break and the patient can suffer from stroke if this happens in the brain. Stroke is also caused by the blood clot or thrombus that clog the flow of blood in the brain. Angina and the myocardial infarction. If the lumen of the coronary artery is narrow, the insufficient oxygen supply to the heart muscle can cause the angina, which is the severe chest pain. If the artery is completely clogged, the myocardial infarction will occur.